Very good evening, ladies and gentlemen, and a very warm welcome to a yet another session from the second last day of the biggest virtual implantology event of 2020. My name is Ruben Lobo, and on behalf of DentistChannel.Online, I warmly invite you to this session. Ladies and gentlemen, due to a slight technical glitch, the speaker who was initially assigned for this session cannot join us, but we have more exciting news for you. Yes, ladies and gentlemen, the last time we had a very special speaker amongst us. Yes, the person who got a lot of comments and all your thank you messages. Yes, I'm talking about the very one and only Dr. Shoukath Ali. The last time Dr. Shoukath Ali joined us, he spoke about short implants, and what a wonderful presentation that was. Today is a very special day, and I feel we DentistChannel.Online are very privileged to have Dr. Shoukath Ali once again with us. Short while from now, about 3 hours back, because of the technical glitch, we understood that the speaker who was assigned for this session could not join. We were very worried because we didn't want to disappoint all you lovely people. So we thought, why not invite the one and only Dr. Shoukath Ali once again. The minute I messaged Dr. Shoukath Ali, he told me, Ruben, I am busy in a case, but Dentist Channel Online will always be a priority. He handled his case. He made a presentation for today, and once again, he's with us. I have no words. I'm definitely speechless. That is the kind of personality Dr. Shoukath Ali is, and that is the kind of love he has when it comes to teaching and giving back to the profession. Dear Dr. Shoukath Ali, I think my thank you messages will be less for all that you've been doing for us. You are such a personality with such a tight schedule, but still you've managed to manage your clinical case, the case that you had when I spoke to you, as well as making yourself free for this 1 hour. Ladies and gentlemen, I know it's so difficult to make time in your heavy schedules, of course, because after the lockdown, like Dr. Shoukath Ali, all the other practitioners have been super busy because of the kind of burden that they have when it comes to practice. But still, Dr. Shoukath Ali said yes, and he said, Ruben, don't worry, you have me, you have got my back. Ladies and gentlemen, yes, it's Dr. Shoukath Ali, and I am so excited to have him once again after the short implant session. Today's session is going to be on bone graft. A lot of people asked us, please, if we could have a session on bone graft, please, if we could have Dr. Shoukath Ali once again speaking on another Power Pack seminar. And yes, here he is, the master himself, the person himself, and the personality himself. So a short introduction about our speaker for today, Dr. Shoukath Ali. Yes, most of you all know him. Still, quickly, I'd like to give a short introduction. Dr. Shoukath Ali is a specialist implantologist who has 20 plus years of experience in dentistry and 15 plus years of experience in implantology. He's undergone various advanced programs from the Temple University, USA, as well as the University of Toronto, Canada. He has done his master's from Austria. He is one of those few specialists dental implantologist who holds both the DHA, the Dubai Health Authority license, as well as the Ministry of Health Sharjah license to practice implantology in UAE. He is an international speaker, trainer, and mentor, and has been invited to several platforms internationally and nationally for CME programs like countries Austria, Germany, UAE, and India. Ladies and gentlemen, once again, it's such an honor to have Dr. Shoukath Ali. Without much further delay, presenting to you Dr. Shoukath Ali once again live. Over to you, Dr. Shoukath.
Thank you, Ruben. Thank you for this kind introduction. So I will directly coming to the presentation. So everything is clear, Ruben?
We're all set, sir.
If I'm to speak, if I'm to speak 10 minutes, I need a week for preparation. But if it's for 1 hour, I'm ready now. So this is a very short notice program, but same time, this is very important. Most of the time we are coming across this question regarding bone graft. There are so many graft materials available all over the world, and people are confused. So today's presentation is on a very simple topic. I will make it a little more simple way in order to help GP doctors to practice their bone graft tomorrow onwards. Most of the photographs you can see here is taken by a small camera, which I have used to take same photo. It's very difficult to handle DSLR camera during surgeries. So you have to excuse me if the photographs are not very clear or very standard up to your expectations. This is one of a procedure, a difficult procedure, almost 2 bone in the maxilla, sinus is lifted and bone graft is done. It's a very little difficult and very big procedure. You can see I have been using osteodensification and nova bone putty in this case. After placing all the implants same time, you can see here I have used some crystals. Today's topic is about this part because this is a very special synthetic material which will form into one mass when it is touching to the blood or cell. Name is Easy Graft. You can see I have used some membrane above that. Usually I don't need a membrane when I am using Easy Graft. So here, this is after healing and after restoration. So this is a very difficult part, but now the all other presentations, all the cases I'm discussing here is simple. You can see a failure root canal extraction is done. I usually encourage all GPs to make this practice, and it will be very beneficial for the patient and for the doctor also. Just simply remove the tooth and send the patient is the old age method. Now we have to do some procedure to preserve the socket and preserve the bone so that anyone else, if you are not doing, anyone else can place an implant without difficulty in that site in future. So this is after extraction of the tooth. This is an Easy Graft crystal. It's placed into the site and there is no membrane, there is no soft tissue mobilization. It's directly injected into the site and left the patient like that. Even you don't need a suture in this case. So that part, it will get hardened and new epithelial cells will start growing above that and everything will be buried inside. This case, the next day patient has called me. She said, I have seen some particles in my mouth. I have collected it and kept it in a bag. So she has taken a photo and sent it. So the next day when she come, she bought it, and this is a graft material. Actually, when we place the graft material inside the socket, whatever is excess, it will fall. The remaining thing will be staying there, stable, and it is enough to preserve the bone in the site. Here you can see, this is a very long case. X-ray, you can see the graft is in place, and here you can see the entire socket is not filled with graft. Only the entrance is filled. The remaining part, the bone, this area, blood collecting here will be turning into the new bone. So this is day wise. On the third day, you can see the soft tissue is healing, and you can see on the 10th day, new epithelialization started, and on the third month, everything is inside the gum. And on 8th month, this is perfectly all right. You can see very hard bone and almost laying the procedure. So 1.5 years when she come, it was just like extraction is done yesterday because no bone loss at all. All of us know alveolar bone will be losing around 25% in that, by the first year itself. So here you can see when I try to place the implant, you can see behind this there is already 2 implants placed sometime back. So here when the soft tissue is open, you can see the thick soft tissue and the very solid rock hard cortical bone in the maxilla. So here is that bone and little more clear, and implant is placed. This is after the implant on the 10th day, and 2 year, this is after 6 months. So on the after 6 months of implant placement. So after bone graft, this is second year. When I enter the area, you can see the bone is like mandible. So the implant is restored and finished. So this is a simple way I wanted to show you how long this bone graft will be stable in place. After extraction, if without bone resorption, if you can preserve the bone around 2 years, means by the time patient may be able to arrange some way he can able to do an implant and save the bone. This will not be if it is a synthetic graft material. Resorb, resorb and finish by very quickly. In the easy graft itself, there are two types products coming. One is the easy graft crystal and one is the easy graft classic. If somebody want to do implant quickly, means within a short period of time, usually advised to use easy graft classic. The crystals will last long, and it's a beta tri calcium phosphate and hydroxyapatite. So we know this. There is no, there are so many uh, this kind of synthetic graft materials in the market. But this is the only graft material I have seen I can use in the socket without closing the soft tissue or without using any membranes. So this is quite easy. I am not promoting any product, but same time, I'll be sharing all my good experience. Like we all are friends, and we have to share our experience. If somebody is getting little help out of that, or if somebody is, if it can be helpful for someone or if any of the patients, that's a great thing. So just for the information, there are so many graft materials in my practice. So each graft material will be using depends on what site it has to be used. For example, if it's a case I have to do a sinus lift, I have to, or if the case I have to do it finish fast, then I will not be using these easy graft crystals. So there I have some other options. So here, after restoration, this is finished. So I usually show this slide and usually tell my colleagues, if it's a GP practice, doing same thing again and again, expecting a different result tomorrow is foolishness. We have to do something differently to get a different result. Every GP practice, doctors are removing the tooth beautifully than most of the specialists, because that's a, most of the time that's a case they are handling, and they are handling and they are masters in that. So when they remove the tooth, just because do not have an education to preserve the socket, remove the tooth and send it like that. And after few years or few months, they will be referred to an implantologist to do the implant. So the first problem implantologist will be facing is to build up the bone. But same time, if the GP has removed the tooth, if they have done a simple way bone graft in the site, how long it will take? You cannot spend time more than 2 minutes to finish this bone graft. So you will be seeing how it will be done. So once the site is cleaned, every socket wall has to be 20 times curate. So no periodontal ligament, no abscess, infection, everything is cleaned perfectly. Once the site is cleaned perfectly, there will be fresh bleeding into the socket. That's the time you have to mix the easy graft and fix into the socket. Just push into the socket with the syringe. Here, I was posting this question in among few dentist groups. I was asking such a very big socket, such a very big jumping gap. How can you do this one? There were a lot of answers, but none of the answers were as simple as this procedure. I have done it here. Here you can see the jumping gap after placing the implant, after extraction and after placing the implant is very big. So easy graft is mixed and just filled into the site, and same time healing abutment is placed and simple suture is done. It is not completely closed, no primary, we are not expecting healing by primary intention. So this will be healing by secondary intention, and there is no watertight and tension-free closure. It is just a tension-free closure. So this is after healing. You can see the X-ray. The extraction socket is completely healed and completely turned into new bone. So this is a beautiful bridge. When the engineers came to make the bridge, one cobbler sitting on beside, he was telling it's not possible because I have been here in this bank of this river for 30 years. I know how deep this river is, how fast and how forcefully this river current is. So you cannot make a bridge across this river because there is no seasons without water, full water in this river. So every day engineer group will come and the workers will come, they will do something there and go. Every day he used to tell not possible, not possible. One day, the day of inauguration came. That day he was asking, this is not possible, but how did it became possible? That's what you're going to see. When I show these kind of cases, sometimes I show the restoration, you can see the bond. So usually the questions are coming, the doubt is from when the synthetic material is placed next to the implant, that you can see the bone, how beautifully this is converted into new bone.
All right, ladies and gentlemen, sincere apologies once again. Dr. Shoukath is facing a technical glitch, and you know when it's a technical glitch, it's very difficult to stay connected. So till the time he's connecting back, I request you to hold
Okay.
on for some time.
Yeah. Okay. So
Right.
sorry for that. Some
I request
issue
you
is
to
going
stop
on.
your video
Anyway,
so that, yes, you can now proceed, sir. Thank you.
Is it okay now?
Yes, sir.
Okay,
Please proceed.
okay. So this case, we have removed the tooth, and tooth removal is with a normal burr, but it's not going deep into the bone. It's just to split the both roots. So once it is done, you can see the tooth is removed in a traumatic way. That's very important in any extraction. If we are going to place the implant, there should be buccal bone. If no buccal bone, it's called no implant. So here, the mesial root implant is placed and planning to give a premolar crown on that and move the distal second molar into this site, and third molar will expect to erupt into the normal position. There'll be some occlusal difficulties, but orthodontist will be correcting that one. So here the easy graft is mixed and placed into the site after healing, not healing, on the seventh day when the patient comes. This is how it is. So you can see some graft material here, but it's okay. Epithelialization will be there, and this is after restoration, and this is after restoration. No, restoration phase, and this is after restoration. Now, you may be having a lot of doubts regarding this procedure. Two more cases you will see, and after that we'll be having a small question answer session at the end, so everything can be asked there. Sometimes patient will come for a simple extraction and implant or bone graft. So here, this was one fine morning, this gentleman has come, but he says 6 to extract. But when we see the full picture, we will see some surprises. You can see third molar is impacted this way, second molar is completely inside this way, and I have to remove this failure root canal in this side. So when I remove this one of the biggest challenges, I should not disturb the bone around this impacted tooth, because if the extraction and after that if something happened to this one, then I will have to remove these and these together. It's going to be a very big long surgery. So such scenario, I have removed this single tooth and placed implant in the mesial root. Again, you can see this is a drilling without disturbing, without going that side. So this bone in this area around the tooth is not disturbed at all. So this is a drill in the mesial root, and this is after healing. You will see the stages, and these all are implants and healing abutment same time. So you can see the healing abutment is placed. You can see this area. This is the area of interest. We have placed some bone graft in here. That's a easy graft. And once this bone has turned into normal bone, I'm not going to open this site. I'm just dealing with this site and place the crown. You will see why I am only placing the crown here, other than making a full tooth like a normal molar. Here you can see these are stages of healing, and this after healing abutment is removed. And here you can see all the bone graft material as turned into new bone without any disturbance to this inside tooth. So this is a restoration stage. See the soft tissue. It's beautifully without any problem on the underlying sleeping second molar and third molar. So this restoration phase, you can see a small crown. It's not a big crown with a cantilever, not like a molar, but same time little bigger than the premolar. Why? This is the answer. because this supra eruption is not allowing me to place implant in the right place and making the crown in the right way. The other issue is I don't want to approach towards that second molar which is impacted, and patient is not interested to bring it back to the occlusion by orthodontic treatment and maybe the opening of the second molar and bring it back to the occlusion. Most of the time people don't want to go for big procedures. He's not going to give any issues. He came with a small tooth problem. One tooth is root canal treated and now it's failed. I want to remove it and place one implant. The problem is solved without damaging the neighboring sleeping issues, without bringing back the sleeping issues, without damaging the neighboring tooth. So here you can see the soft tissue, and all these cases, whatever you have seen is single stage other than the first one, because the first one was only mere bone graft. Then after 1.5 years, I was opening and placing the implant. All the other cases, extraction and immediate implant, everything is with the healing abutment. So that means everything is in single stage surgeries. Still, there are a lot of doctors who don't believe in full success, maybe 100% success of this procedure. So I hope by finishing this one, they may get little more courage to do this procedure. Here it's a aesthetic area, premolar is broken and vertical fracture. It's removed, again a traumatic extraction. You can see the socket and the drill and the implant. This is after the implant, the easy graft is inserting into the site. So that is inserted. Then I was placing the healing abutment. So that healing abutment in the place was holding a portion of the bone graft material. I don't have a primary closure here. I didn't mobilize the soft tissue. No membrane is used. It is as simple as that. So she was a teacher. So she wanted to have a temporary something in that area. So we have given a 6 retainer. And here you can see after healing, some portion of the jumping gap was filled with the bone graft and the soft tissue has matured all around. You can see a small particle here. This is a particle of easy graft. It will shed and go away. It's not a problem. So this is a 6 retainer. It was just keeping when she is going to the school. So this, you can see plaque accumulated in the around the healing abutment. Still you see the soft tissue, how beautifully it's in the right place, the right way. And you can see the adjacent tooth, gingival margin is here, this is here, this is here. This is after restoration. So we want to get this kind of result, means we have to select the right bone graft in right indicated area. So I'm handing over to Ruben for any questions about today's session. I'm sorry for the interruption in between. So a small word about my Do It Institute. Last session you were, oh, Dr. Ashin is there. Okay, very good. Last session you might have heard about this. This is nothing, not a very big institution. It's just to help those who are doing implant. If you have any questions during your procedure or any treatment plan issues, you can discuss. I'll be there online in this platform or any, usually Facebook is very easy for everyone to get access. And you can post the questions regarding your cases. We can discuss about that. Or you can communicate through DentistChannel.Online. That is little more easy and wide reaching platform. Thank you very much and waiting for your questions.
So we have first question from Dr. Arushi. Can we place the graft on the same day as of extraction? Sir?
Yeah, usually we have different method to do it. One method is after extraction, we can wait for the soft tissue to heal. Then open the site, curate everything, put the graft. But why? Why we are doing that? Because if we can clear all the infection, if it is on our body, we don't want to put an injection and open again. So usually make all the surgical procedures less. Clear it, all the infection, clean all the infection if it is possible. Then once infection is clear, then you can use, there are plenty of graft material. For example, if you use some stenograft, some bovine or something, you can pack the site, but you need to mobilize soft tissue, then make a primary closure about that. It should be watertight and tension-free closure. That will be giving some swelling, and the procedure itself is little difficult. First, you have to mobilize the flap. So you have to raise the flap. So this is little more difficult one. But this way, you don't need a membrane. You don't have to cover. If other than the using mobilizing the flap, the olden method, what we used to do, we pack some stenograft or some graft material inside. Then we used to use a PTFE membrane. Use the membrane above that, cut the membrane and tack into both sides, buccally and palatally or lingually. Then put a suture, make a primary closure from soft tissue. But again, on the 28th day, you have to call the patient, remove that PTFE membrane. So the issue is that you need a PTFE membrane. You have to call the patient again. But here, you don't need a membrane because once this is mixed and placed into the site, everything will be like a single block. So you don't need a membrane, and you don't have to call the patient to remove it, other than if you put a suture, you have to remove the suture if it is a non-resorbable. Other than that, you don't have to call the patient. Maybe if somebody else is doing an implant, then you can directly refer the patient to go there. You don't have to see the patient. That's the one advantage. Then there are another way. Take the tooth, then place the implant, then you will have a small jumping gap. You don't have to do any grafting the site, just close it with healing abutment. The problem is if the buccal bone is very thin and if the bone lost, then it's a very big aesthetic issue. But there what you can do, you can place little bone graft material inside. That the best bone graft material is autogenous bone. Again, when you place the autogenous bone inside, you have to take that autogenous bone from somewhere else, or maybe from the drilling site if you get. So use that bone graft material, but again, you need a full closure. If you leave it open, nothing is going to happen, because by secondary healing, epithelialization will be there. Everything will go inside this without any infection or any problems. I hope
Yes.
I have answered the question.
Yes, sir. Thank you so much. So we'll move ahead with the next question from Dr. Rita. She's asking which graft material is best. Sir, I repeat the question. Which graft material is best?
Sorry.
Hello. So which graft material is best?
You mean the which graft is best? Is
Yeah.
that the question?
Yeah, yes, sir.
See, for example, uh, there are a lot of factors. The best and And the gold standard, as we all know, is the autogenous bone.
Yes. Further, Dr.
Bone.
Rahul asked,
You need a you need some small instruments in your practice. It's not very difficult to take some bone from ramus behind the molar area. Very difficult procedure, but unfortunately, that part is not trained for the GPs.
yes,
It is done by usually oral surgeons or implantologists. So you have to learn how to take the bone from that site. And there are some small refined drills which you can easily use and collect the bone from the site. That's a gold standard. Or there are different methods. So if that is not possible, how it is not possible? Number one, patient will not agree for that. If not agreeing, then that part is not there. Then you have to go for some other graft materials. You have synthetic graft materials and you have xenograft materials, maybe some animals or something that will be taken like bovine, and from the horse it is there, and from the pig it is there. So you can go for xenograft material, or you can go for the cadaver bone.